Hello, dear friend. Today we're going to talk about varicocele. It's a simple name for a very common disease. And today in this video, if you watch it until the end, you'll find out who needs surgery for it and who doesn't necessarily need to touch it, and you'll also learn about the serious conditions associated with it. This is a sign that you urgently need to run and get additional tests, otherwise time will be lost and it will no longer be possible to help the person. As you know, in many vertebrate animals, the testes are located inside the abdomen. But it so happened that in many mammals, I would even say almost all of them, the testes are located in the scrotum. It's a kind of leather pouch. By the way, I was surprised that many of you don't know what a scrotum is. The scrotum is where your testes are. Why are they there? It's very simple. They prefer a temperature that's about 1.5 to 2 degrees lower than the temperature inside your abdomen. If the temperature rises, they work very poorly. It's specifically for thermoregulation, specifically to lower the temperature, that they are located in the scrotum so that everything can be cooled by the wind and not overheat. That's why, of course, it's not very good that we wear pants, tight underwear, and use heated seats. All of this is not good for our testicles. There is a disease called varicocele. You've likely encountered people with hemorrhoids who complain about lumps, or those with varicose veins in their legs, causing fatigue and swelling by evening. Basically, varicocele is the same kind of varicose conglomerate. These are altered vessels, just like in the legs, or hemorrhoids, which are essentially altered venous vessels, but in the scrotum. And this leads to the fact that if in the legs it causes swelling, then basically the same kind of lymphostasis happens in the testicles. That is, the lymph gets stagnant. That's the first thing. Second, the blood that doesn't drain well from the testicle causes the testicle to overheat. Third, sometimes it even happens that in this blood, since it flows from top to bottom, there are hormonal traces from the kidneys and adrenal glands. And that's not very good. What are the symptoms? Actually, there's a lot to say about varicocele. Let's start with how it looks and how it manifests itself. It manifests very simply. 95% of all varicoceles are on the left side. Remember, the left side accounts for 95%. It is usually detected during adolescence. Sometimes it hurts, sometimes it doesn't. It becomes noticeable on the outside, usually at the second or third stage of the disease. At the first stage, it's rarely noticeable. What does it look like visually? You may feel or see the changed varicose nodes above the testicle, which sometimes even get bigger when you tense your abs. Does everyone need to get treated? Regrettably, schools check for it, even checking me personally. After the draft board commission, they send everyone to get treated and operated on. It's believed that varicocele occurs in about 20 to 25% of the population, which means almost every fourth person has it. But if you look at all infertile couples where there is a male infertility factor, it's believed that in these couples, 40% of men have varicocele. Here's one of the reasons why we're generally concerned about varicocele. Its presence has a harmful effect on the left testicle, and along with the left, the right one actually starts to suffer as well. Because of vascular reactions, the right one is also affected. Therefore, the earlier you operate on varicocele, the better. But does everyone need surgery for it? Of course not. First of all, not everyone can have surgery for it. There's also what I mentioned at the very beginning, symptomatic varicocele. That is, if suddenly at the age of 35 or 40, a young man, I had such a patient recently, varicocele appeared during an appointment, and he hadn't had it before, and it became quite pronounced, especially on the right side. So you know what you need to do first. Send him for either a magnetic resonance imaging, a computed tomography scan, or an ultrasound of the abdominal cavity. There might be some kind of tumor that's compressing the vein, which is why blood from the testicle stops flowing properly. So what seems like a harmless problem can actually be, and often is, a sign of a tumor process. It's crucial to note that varicocele typically begins in the teenage years. If you don't have varicocele by age 30 or 35, and then it suddenly appears and progresses quickly, you should urgently go for an examination and get checked. There have been cases when unqualified doctors operated on such varicoceles and naturally missed the disease and missed the opportunity to give the patient a chance to recover in time. That's why this is very, very important. Never forget this under any circumstances. It's actually very easy to detect. First, you can feel it with your hand. And when you tense your abdominal muscles, you can even feel these veins as they become tense if there is blood flowing into them. When you increase abdominal pressure, blood is released and you can feel the veins swelling under your hands. Even without palpation, without feeling them, sometimes these veins are visible to the naked eye. If the degree of varicocele is pronounced, it doesn't become pronounced right away. It might appear, say, at 14 years old and then gradually progress each year. Naturally, the risk of developing varicocele is higher in those who have varicose veins in their lower limbs and in those who experienced rapid and intense growth during a certain period of their life. There are also symptomatic varicoceles, not only in cases of tumors. It can be congenital, but still symptomatic, conditionally symptomatic, due to a specific anatomical feature. This is called nutcracker syndrome, when an artery that actually belongs to a completely different organ goes down very sharply and compresses the renal vein. This is called nutcracker syndrome. The pressure in the renal vein increases because of this. Accordingly, we have varicocele. It's the simplest and most accessible, and almost every clinic has it. Diagnosis is ultrasound, supplemented by Doppler study. That is, you can see how enlarged these veins are, whether there is any pathological reflux in them, and make sure that your problems are actually related to this. Because there are people who feel pain and there are people who don't. If varicocele is confirmed and it hurts, surgery is needed. If it doesn't hurt, who needs surgery and who doesn't? Because sometimes varicocele is very pronounced but doesn't hurt, and sometimes it's small but hurts a lot after physical activity. If you feel pain in the left side of the scrotum after having sex, or, for example, after interrupted intercourse and the pain appears in the left side of the scrotum, you should get checked for varicocele. Unfortunately, very often, up to 20% of varicocele surgeries are performed on people who actually don't have it. Because this surgery is good for many young surgeons, many general surgeons learn by doing appendectomies. Truthfully, many appendixes worldwide are removed even when there is no appendicitis. The cause may be intestinal colic, but the appendix is removed anyway. It doesn't worsen the situation and the surgeon gains experience. Unfortunately, this is something many people don't talk about out loud, but that's how it is. The same goes for varicocele. They operated on it, didn't make things worse, but in fact, the person still has pain. The pain persisted due to prostatitis, an inguinal hernia, or a type of pelvic dysfunction. That's why it's extremely important to identify the cause and effect relationship. Is it really varicocele? How can you tell? Well, first of all, varicocele never starts hurting suddenly. It's always gradual. If your varicocele suddenly started hurting since yesterday, you should really think about whether it's actually varicocele. Another indication is a decrease in sperm quality, also known as pathospermia, which means an abnormal sperm analysis, not a very good one. Naturally, if you have surgery at an early stage, up to 70 to 80% of the changes that have occurred by that point can regress, meaning they can be reversed. And the third indication for surgery, who should undergo surgery, is organ atrophy. Because of all these hemodynamic disorders, meaning when blood circulation doesn't happen as it should, the testicle begins to atrophy. How can you tell? It's very simple. It becomes less dense. It becomes smaller than the opposite one. Then surgery is necessary. And what are the ways to operate? There are actually many of them, but I would divide them into three. The first are conservative methods of treating varicocele. These include ointments, creams, and so on. Frauds and charlatans often claim to treat varicocele with pills or ointments, which is not possible. And that's why if someone prescribes you something for treating varicocele and says it will go away because of it, please just change your doctor. The second option is open surgeries, laparoscopic surgeries like Ivanisevic, Palomo, Marmara, microsurgery, or a standard operation through a mini access. There are many variations. The best one is the one the surgeon is most skilled at. I have my own technique. I call it the Japanese technique. I will always stand by it, as I never have complications with it. I'm very satisfied with the cosmetic results. If you ask someone who practices microsurgery, he'll say that microsurgery is the best. But if he does it, in my opinion, he'll discredit my method. If I do it his way, I might discredit his method. So don't force a surgeon to use a method you want him to operate with. Choose a surgeon you trust and have the surgery. What I don't recommend, to be honest, is laparoscopic removal, meaning clipping. First of all, it's a deep general anesthesia. Secondly, it's entering the abdominal cavity, which in itself comes with a number of complications. Because most of the surgeons who do this are young, inexperienced surgeons. Again, this is a surgery where people learn to play sports, manipulate and operate. That's why I would never send my child for laparoscopy in my life. Microsurgery is a good method too. I used to practice it at one time, and I have a lot of experience with microsurgical approaches. And the last one, probably, is the third group. This is not open surgery. These are endovascular treatment methods. They are also diagnostic methods. This is when a large vessel is punctured, your veins are contrasted through it, and at the same time, if varicocele is confirmed, a medication is injected that seals these abnormal veins. I usually support resorting to the endovascular, to this third method, after you suddenly have a recurrence, to confirm that it's a recurrence, to understand where this recurrence is coming from, and then to embolize or do something about it. Recurrences are often not confirmed, or the initial surgery was of poor quality, so it's not a true recurrence. Something wasn't tied off. But again, if you ask someone who only practices endovascular surgery how to operate, how to diagnose, he'll say that the first step for everyone should always be immediate embolization. That's why every surgeon makes their own choice. But for primary patients, I recommend choosing not laparoscopy, but simple treatment methods, and only then, in case of recurrence, resorting to endovascular treatment methods. Are there any complications if the operation seems to be simple? Yes, complications like hydrocele can occur after these operations if done incorrectly or if there are issues with healing. I have seen patients whose sperm count dropped to 0 after the operation because they had only one testicle. The vas deferens was either tied off or injured, and they became infertile. I have seen patients whose testicle died after the operation. It is especially critical to have this done by skilled hands if the operation is a repeat one, or if there was, for example, an inguinal hernia on that side. In fact, both patients I saw whose testicle died were patients who had previously had inguinal hernias. Apparently, during the first surgery, a main vessel was either clamped or injured, and the second one was damaged during the second operation. It is very important to treat every surgery with respect. There are no simple surgeries. There are no complex surgeries. Complications, mistakes, and bad outcomes can happen anywhere and to any specialist. And if you might think, have developed varicocele and it doesn't really bother you that much, will it depend on your lifestyle whether this discomfort or symptoms will appear? Of course it will. Weightlifting, for example, especially if you use a weightlifting belt, will provoke the worsening of varicocele. That is, if you, for example, don't do weightlifting. You might, in your everyday normal life, the way you live, it may remain at the first stage and you will live without any symptoms or indications for surgery. But if you overdo it, if you start gaining weight, excess weight is also a provoking factor, then accordingly the degree of varicocele will most likely increase and it may eventually start to hurt and you'll have to have surgery. Why do people ask about this disease so often if it's so simple to diagnose? Why does it happen so often that you go to one place and they say you need surgery, you go to another place and they say you don't need surgery, and then you go to a third place and they say you don't have varicocele at all? Unfortunately, that's true. Many people just treat this disease very simply and lightly. I'll say it again, they indicate surgery where it's not necessary for different reasons. I don't want to say out loud, but for different reasons. Unfortunately, this is often practiced. Even one of my friends had an appointment. He had pain related to the right testicle's epididymis. There was a cyst. Naturally, with medication, the cyst was getting smaller and stopped hurting. They informed him of a varicocele on the right, but you recall it's actually on the left and requires surgery to alleviate the pain. I immediately thought that something was off because varicocele first appeared when he was already, 30 years old. And suddenly it started to hurt. That's one. Secondly, for some reason, it appeared on the right side. Typically, the right side joins the left due to a different vein connection on the right. That also confused me. Why is there nothing on the left and only on the right? And thirdly, why does it go away when taking anti-inflammatory drugs and medications? During the ultrasound, I noticed a cyst. It's decreasing in size, which explains why he doesn't feel any pain. After puncturing the cyst, the varicocele and associated pain disappeared. However, the cyst grew again and the pain returned, revealing that the cyst, not the varicocele, was the real problem. You have to understand how upsetting it is to go through surgery, hopefully without complications, and then leave with the same problem you came to the surgeon for, while the surgeon just shrugs his shoulders. That's why you should always measure 7 times and cut once, as the saying goes. And I really hope that this video will help you choose both the right surgeon and the right treatment method. I hope you enjoyed this video, so please write in the comments which diseases and conditions you would like to learn more about on our channel. Be sure to subscribe, hit the bell, and be the first to watch our new episodes about diseases.